first of all, I'd like to thank Dr. Param for joining us today. Thank you, Dr. Saab, for sparing out time from your busy schedule. And
Thank you for having me.
I'll
Thank
take the liberty of introducing you to our subscribers, the students, and the people who are, actually going to watch this video. So, Dr. Param, I am privileged to call him a dear friend. In his inner circle, he's known as, we call him Param instead of Dr. Parampreet Singh ji. After 12th, Dr. Saab went on a journey of MBBS where he started his MBBS from B.R. Ambedkar Medical College, Bangalore. After completing his MBBS, he did not just stop there, went on and joined Guru Ramdas Ji Medical College, Amritsar as MS Ortho. So, lived his dream of becoming an orthopedic surgeon. Added a feather to his hat by doing another course in pain management from Bangalore, from Somaya College. And I know him personally, so I can tell you a little more about Dr. Param. He is one of few people I know who have the heart of a little sparrow. Dr. Saab saw a lot of problems which these kids used to face, kids born with disability and all. So he vouches a lot of time monthly to a lot of organizations. Smile Train being one of them. If I'm not wrong, that's the name of the organization, right, Doctor?
you. That's correct. That's
Dr. Saab does a lot of free surgeries annually on kids who are, born with special, uh, what is the right word for it? Some sort of
they
a
have
child disorder,
yes. They have congenital birth defects.
Okay.
Those are called cleft lips and cleft palates, in which the lips and the mouth they are not fully developed. So
Okay.
we do free surgeries. We treat them free of cost, no
Mhm.
charges, not even a single penny is taken from them, and the reconstruction surgeries are done.
Very, very good. So we put a very small teaser on our Instagram page saying that we are going to interview an orthopedic surgeon. So we got almost 45, 47 questions from students and students who are aspirants to be MBBS. And we've shot because I know Dr. Saab, you don't have a lot of time and you're sparing out of your OT day today. So about 7 to 8 questions we want to ask you. So if
Okay,
you give me a go ahead, we'll start.
sure. Looking forward, please.
So first question which came to us was how has your journey been after you passed your 12th? Because now you have to give your NEET exam and then NEET PG and then there are so many exams involved. So how was your journey? What are the challenges you faced? How did you overcome them?
Okay. So first of all, I'd like to, thank you for giving me this opportunity to, put my words forward. So my experiences so far. So the question that you asked, how my journey has been. So it's been a roller coaster ride. Uh, so I'm almost 35, 36 years old now. I'm 30. I'm turning 36 very soon. But this journey exactly became, started when I was 16 years old, 16 or 17. So I was half my age. I was very young. Still I am. So it's been a roller coaster ride for me. Uh, After my plus two exams, I could get an opportunity. Being from a small city such as Amritsar back then, Amritsar wasn't on very big scale. So I did my graduation, went to Bangalore. So it was in that particular city that I, got the much exposure I always needed. So the journey has been really, with so many highs, lows also, but so far quite good. So you enjoy when I look back at the time, when it all started. We were just like kids. So and with this thing in mind, I had one notion in my mind that yes, I want to achieve something. I want to make a good life for myself, and I had very like any other kid of that age. I had lot many dreams and aspirations, and I feel pretty satisfied that the way life has treated me, God has gifted me in abundance, and I'm really enjoying my life a lot. So that's all because of the decisions, probably, I think, that I took. And moreover, the another essential thing I would add on is that I believed in myself. I believed that I could achieve my goals over a period of time. So I worked hard for it, kept on. I had kept my faith at each and every step in the process, and I think so far I'm pretty decently happy with the way things have turned out for me.
Really good. So, Dr. Saab, like you said, journey of becoming a doctor started back when you were 16. So
Yes, yes.
very you can call it a sweet or a sour age, because that's when a lot of changes happen in your brain, and you start thinking maybe on the right track, or you get off track like a lot of students do. So what actually motivated you to become a doctor? What was the main motivation behind becoming a doctor? Because like you said, you come from a town of Amritsar, which is more of an industrial and a tourism town than attracting medical tourism. Thanks to you, I'll come to that also, that we're getting a lot of medical tourism now in Amritsar and Taran Taran. So, but what motivated you at that point in time to become a doctor?
I always, dreamt of becoming a physician since I would say when I was a child. So it was just being a doctor that I dreamt of as profession. So I knew in myself that this is what I want to do. This is how I picture myself in the coming times to see. So I used to see to a lot many senior doctors uh, who probably I used to see how their life is, what kind of things they do, when being a kid. So what are the discussions they have? Because in my family there are a lot many doctors, my cousins, they all are elders. So my uncle, my aunties. So I used to very closely observe them. So I never had a second thought in my mind that I would be doing anything else rather than being a doctor. So it was pretty clear, and I think I knew instantly that how the life is going to be up ahead.
Right. So, motivation being a part, do you think it is important to have a mentor in life when you choose a profession? And did someone mentor you through your journey?
Absolutely, it's 100% necessity that you look upon to somebody and you set your mental parameters that yes, this is the kind of life I want to achieve for myself. So for me, my elder cousins, they've been pretty they had a very motivational effect on me. They inspired me to pursue career in medicine. So I always looked upon to them to see that yes, they have achieved something, and the sense of well-being and fulfillment that they were feeling. They at that time they were just about to finish their MBBS. So it really brought me happiness that yes, I also want to have my life worked out in such a manner. So I used to take a lot of advice from them. How what should I do, how should I do, where should I begin from, all those things. So from scratch they were there to guide me. So I feel without somebody mentoring or guiding you, you are just moving in the dark.
Hmm.
So you need to have a direction, and that direction can only be given to you by somebody who has walked that path.
Doctor, Saab, just a question which is not from the questions which I received. This is something which crossed my mind, if you allow me. So, not everyone is blessed to be from a doctor's background and have cousins or family in the same profession. So, I'm sure a lot of your friends would be facing that challenge also. So, what is your advice for these students who are maybe from a business family or maybe from a service family? So, what is it that they should do differently, or how to, focus or maybe zero down on a person who they can make a mentor? I hope you understand what I'm saying, where this question is going. So, what is your advice to these people?
one simple advice to them would be just believe in yourself.
Believe in yourself. Okay.
So once you believe in yourself, everything works out the way you wanted to work it out. So you just start, and when you start, right from that very moment, channels would keep up on opening, and you have to try. You just have to try until you succeed. So there is no shortcut to not only medicine, I would say, rather to any profession of that choice. So whether from a medical background family or from a service family or from a business class family, I think once you believe that yes, you can do it, so there's no stopping you. So that's the mantra for me, that you should just keep on trying and have faith in yourself. So rest is everything. When you look upon it now, after you have achieved, you said yes, this is how I achieved it. So, and those are the experiences that you take forward in your life, in your personal life as well, in your family life as well, in your financial life as well. You have to keep faith in yourself. So that's the only thing you need. Rest everything will fall in its own place.
Dr. Saab, like there's a trend of medical tourism in India. We've been following
Yes.
it closely that a lot of people from different countries they come to India, in your case for orthopedic surgeries. But
Yeah.
I see that there are some doctors who even travel overseas for surgeries, and they are able to help patients to recover, and maybe some country where the facilities are not as updated and as good as in India. And if I am not wrong, you are one amongst those doctors who've taken this initiative of going overseas also and practicing. So, if you don't mind, can you tell our students, tell the aspirants, that how did that journey start, and what is the work-life balance for Dr. Parampreet, because you've been traveling so extensively, even overseas, and doing so many surgeries. So, how do you manage it all, and how did it start? So, if you can please tell us that.
Yeah, that's correct. So I have been in charge and handling the international medical program for our hospitals. So what that means is actually that patients from abroad, foreign countries, they come visit India for their medical treatments. So why is that so? Is because India is a very rapid growing economic power, global power, and as far as the health facilities in our country are concerned, let me assure you, we are in the best of hands. So Indian medical health services, they are at par. You name with any country in the world, may it be USA, may it be Canada, Singapore, Great Britain, just to name a few, because the our access to healthcare is pretty easy as compared to those countries. So we do not have to wait for long periods of time to get ourselves treated. So that way we are pretty blessed that we live in a country where healthcare affordability and access even to a common man is within reach. So yes, that's correct. I travel overseas a lot for international medical tourism. So we term it as international medical tourism. So we go there, we see patients, and we screen them, diagnose them, and probably operate upon them also, if that can be done in their setups. And for specialized surgeries, like I specialized in joint replacement surgeries, those are knee replacement surgeries or hip replacement surgeries, and these are pretty advanced surgeries, and they need special kind of hospital setups, which unfortunately the countries where I go to, they do not have. So these patients, they get their clearance from the Department of Tourism and Health, and they come and flow back to India for their operations, and after that they go back. And rather interestingly, patients coming from abroad to India for medical treatment, they save up a lot of money.
Okay.
Yeah. So because our healthcare costs are pretty less as compared to countries such as US or Canada. So
Hmm.
for example, I'm giving you just an instance that a surgery which would have cost say about 10 lakhs in UK or Canada, here in India we just do it in between say 1 to 2 lakhs of rupees. So they almost the costs are reduced by almost 80%. So that's a huge sum of money.
Mhm.
And secondly, Indian doctors, they are very well respected in the medical fraternity all across the globe because of the skills, the dedication, and the hard work they put. And we are very, very blessed that all the top doctors in the world, if you even see in US, Canada, all the Western countries, the chiefs, the head of departments, and the doctors who are heading the very, very large, medical practices there, most of them happen to be Indians. They are graduated from India, and they probably go back abroad, settle there, and start their practice. So the world, as far as medical healthcare facilities are concerned, India has a very, very big contribution to the world across the whole globe. So if you go, instance, in Central Asian countries such as Uzbekistan, Kazakhstan, and those countries, I've been there. I get to be there for doing consultations and procedures. So I've seen that healthcare is not, very well developed in those countries. So these patients, they come to Amritsar for getting their treatments done, and they go back after getting it done. And we provide our services, our consultations to them, because we keep on going to their countries for regular healthcare consultation and camps as well. So, and coming to your second question, how do I manage it? So it's just like pretty the same thing that I manage across in India only. So there's not much of difference. The ethics and the principles of practice, they remain the same. It's just the language barrier that I feel is somewhat difficult to understand their native language. But even I'm now pretty catching it up to.
Right, sir. So, Dr. Sir, just one more thing. Like, if someone wants to practice in a particular country, like if we want to go to US, so you have to qualify your US MLE. If
Yes.
you want to UK, so you have to give your P lab, and soon will change to UK MBA. If a foreign medical graduate wants to come back to India, they have to give a MCI exam. So, like you go to all these different countries, so is there specific examination which you have to give, or you just have to take the credit, the permissions from the government, or how does it work? Is it a lot
Uh,
of paper? It's not that difficult.
No, it's you need proper documentation while going in these countries to perform a surgery or to do your OPD there to see patients and screen them. So most of the permissions, they are granted by the Department of Public Health and public welfare of those
of,
countries.
of those countries.
So
Okay.
yeah, so without the documentation, you cannot go and practice in those countries. You cannot go and see the patients in those countries. So it is only after proper documentation that we can go there. And there are certain exams also, which if you have given, gives you a right across the globe to perform a procedure to see the patient. So those exams are done after your graduation in India. So, and they are valid all across. For example, there's one exam after MBBS which you give. So that gives you access and license to practice your field in the whole of Europe, European Union. So, like you said, USMLE exams are for practicing in the United States. Similarly, Canada has exams for license, which you have to give before you can practice there. Even UK has PLAB exam for this, and Europe has a certain exam. But there are few, underdeveloped countries or areas around the world, such as African countries, South American countries, and some Central Asian countries as well, where there is acute and severe shortage of doctors. So now what they are doing, these countries, is that they are calling doctors probably from India uh, to perform or to give their medical services in those countries. And all the documentations, all the licenses are obtained with the help of the Ministry of Health and Welfare of those countries. So it is not a very tedious process, but yes, it is done. It is a fair process, and once it is done, so you are absolutely without any stress in your mind, you can go and do your job there.
So I think this is a topic for another video if you give us a time. But I'll just short. So we're talking a lot about surgeries right now. So of course, the success behind a successful surgery is the surgeon, which we are confident that you after multiple and multiple surgeries, the patient is in the safe hands. But when it comes to orthopedic or maybe a nerve transplant, so post surgery recovery depends a lot on the exercise and the diet you take, or maybe the schedule you follow. So what do you suggest? I mean, how important is the physiotherapy part after surgery, and what is the post surgery? How important is the exercise and the physiotherapy for a patient?
There's a terminology that we use in practice. It's called post-operative rehabilitation. So, rehabilitation programs are very, very essential for the success of any surgery. So, say, as me as a surgeon, when I do my job, I perform the surgery. My job does not just ends there. So, it's just halfway we are done. So, the rest of the treatment, the protocols, and the rehabilitation, the whole different team comes into play because it is a teamwork. It is a group of team members which come along and they till the treatment is over, so they take it very seriously and they help the patient to get better and better each day. So the physiotherapy team, they predominantly take over once the surgeon performs the surgery upon replace joints. So they help the patients over a period course of days to get them better and better with the previous activities which they had before even the surgery or when they did not have the problem. So that plays a very, very crucial role in getting back to normal in less amount of time. So I would say, I always say this whenever I go for conferences or lectures, that it is just not me that is doing the job. So we have a team of doctors, we have paramedical staff, physiotherapists, and counselors as well, who all do their job and they help to make the patient better after the surgery is done. So it is a teamwork and everybody contributes to make the patients better day by day.
So, Doctor, Saab, just one more question just crossed my mind. Again, something that just crossed my mind is when it comes to bones of a human being. So, male and female, they have different sort of calcium needs, and bone density. If I'm not saying it wrong, so this is a glimpse of what a non-medico has read, a person who's medical background like me. So, any suggestions you want to give to both set of patients how to take your bones? What is a basic suggestion which Dr. Saab can give, Dr. Param can give to these patients that uh, to take your health so that the injuries are less, or you know there are less chances of them to get on an operation theater at this stage. Because I read somewhere that even at the age of 50, 55 now, some people need knee replacement because of lack of the care they take of their body or the bones. So, what suggestion can you give, sir?
Yeah, it's a very relevant question, and the first thing that we need to do is we need to spread awareness. So we need to spread awareness that in case a person is in pain or they have difficulty in doing the activities which they were able to do maybe months before or years before, so that is when they need to get themselves checked by an orthopedic surgeon or orthopedician, number one. Secondly, they need to be physically active. They need they the sedentary lifestyle habits, for the persons especially who are sitting over the laptops or they have office jobs and they don't do exercise. So these are the patients who tend to experience orthopedic problems more than the other people, such as uh, we have observed that the people who do a lot of work on the laptops, they suffer from neck pains or lower back pains, and especially in females who are household ladies, who remain in the house doing all the household work, they suffer a lot from knee pain. It is due to the lifestyle that over the period of time we Indians have adopted, and we have been more sedentary and less of physical exercise or less of physical activity. is the one of the cause that due to which we are experiencing and getting a lot of patients with the knee pains or other joint pains. So my first suggestion would be to maintain a healthy physical activity levels. Don't wait for the disease to progress, so that when they come for screening, by that time their knees or their other joints are pretty badly damaged. So whenever they feel pain, I think rather than having medications for pain by themselves, they should go and consult a doctor. So that is very important. Thirdly, especially young people, adolescent, teenagers, and college going students, they play a very very important role in spreading the awareness, and they educate people around their households and in their neighborhoods, that if a person experiences any kind of a bony problem, that is when they need to see their doctor or consult a doctor, so that they can be properly screened for the disease if they have any. So spreading awareness, one should not feel shy to talk about their health with their family members. So that is very important. So health problems should be openly discussed, and it should be encouraged that in case any family member has a problem, one should go and talk to them, ask how they feel, ask what is troubling them, and so that the proper treatment can be provided. So awareness, and with only awareness, we can tackle a lot many problems, and you do not need to be a doctor to do that. So spreading awareness starts right at your household. Probably, just for example, every household has elderly grandparents or parents who are aging. So they experience a lot of bony pains or knee problems and spine problems. So if we spread awareness and educate them that yes, you need to see a doctor, and you should not have painkillers on your own, that makes a lot of difference. And we can save them from getting systemic diseases such as diabetes. The incidence of diabetes, high blood pressures, thyroid problems, they can go down in a very, very big way if we catch them early. So to catch them early is when somebody would open about their health problems to a family member or to a friend. So all, you don't need to be shy to tell about your health problems to anybody, be it of any age, be it a teenager, be it employee at around age group of 30 to 40 years, or even an elderly person. So awareness, and you should be very comfortable to talk about your health issues. So that is where, once done, so we can control a lot many diseases and prevent a lot many people from getting that disease. So it plays a very very big role.
So in one line, we can summarize it that instead of going to the Google doctor, you should go to a good doctor, because I've seen
Yes,
that
I, th- I think I think rather than being a Google doctor, uh, it's just your common sense and what you feel. So
yes,
that doctor is a much better doctor than a Google doctor. So everybody
okay.
can do the role of a doctor. They can diagnose a lot of things on their own, and they do not need Google for each and everything. So that's very important.
So instead of Google, go to a good doctor is what the awareness should be right now. So
Yes, correct.
now, as we go ahead, so there's a lot of exams which are coming for the aspirant doctors now. First of all, they're going to go through their boards, which is the 12th, which have already started
Mhm.
for cases. And then in May, they will be giving their NEET examination. We have seen a lot of students go through. We were students, you know how the pressures were, and you know how stressed we used to get. But not everyone, how to put it, is able to manage that stress. So what is the suggestion you want to give to these students who are now going to become the future of the medical industry, as might say? So what is the one thing you want to suggest them, how to fight the stress of examination, may it be 12th or may it be NEET?
So it's just like how they do it on with their life. Just take it as it comes. So don't get stressed about thinking what shall happen in the future, what shall not happen. Your job is just to study and give your exams properly, and just leave everything to the Almighty. And don't stress yourself. Take frequent breaks, eat well, sleep well, and you give your mind pretty decent amount of relaxation. If you like music, listen to music. If you like to do some exercise, you should do an exercise. So do not keep thinking about something that might or might not happen in the future, because you cannot control it. So you need to have a very positive framework in your mind, and that is something you should always motivate yourself. You should think good about yourself. Have a very beautiful picture in your mind to achieve, or always think this is something I want to be at, or this is something I want to achieve in maybe 10, 20 years from now. So keeping that goal in mind, you should keep on working hard, be consistent, but also take care of your health, physical and mental both. Do not stress about the things which you cannot control. So there's absolutely no need, and there is, it's not useful at all just to keep on stressing for the things which are not in your hand, which are to be seen in the future. Your job is to just study and give your best. So, and for the rest, leave everything up to God. So that's my suggestion. And always believe in yourself throughout the life. It's just not that these years you are going to do so, but this is the mantra that you should follow for the rest of your lives, and it really helps in a lot many ways. I would give my example. When I was preparing for my MBBS exam, so I used to be pretty stressed. But then I realized myself that it's not helping me at all. So I stopped thinking about what shall happen and what shall not. So I just concentrated all the energy studying. And in the free time, I used to do some exercise. And that really helped me to relieve the tension of my mind. So I used to, I'm a big music fan. So I used to listen to a lot of music in my time to de stress myself. So it really helped me a lot. And rest over a period of time, stresses shall be there, new challenges will keep on coming, but this is the approach that you should be following throughout your life, so even I have some goals set in my mind at this stage that I want to achieve. So I have stress for that, but I cannot foresee the future. So what I can do and what I need to do is just keep on working and be more and more closer to that. So always believe in yourself, have faith, have courage, be happy. Everything will be good only.
Right. So I can see I've taken up a lot of your time. So I'm just going to, sum up on this note that always be happy and take care of your health and rest. Leave everything on the God. Uh, I will, on behalf of me and my team in my medical studies, I really want to thank you for sparing out time today, doctor. And I am sure my inbox is going to flood with a lot of questions and a lot of inquiries after this. So I really request and I want that maybe we can take out one more day and maybe answer those questions if there are some things which need to be catered to for the future doctors. Thank you so much for your time. Means a lot that you came to our channel today. And
Thank you so much, Pravesh, for having me here, spreading on the message to young budding professionals, healthcare professionals, and everybody. So my best wishes to each and everybody for the upcoming exams. I'll be more than happy if anything from my side is needed for interaction. So please feel forward and you can get in touch with me anytime. So my best wishes to you and congratulations to you. You're doing a wonderful job. Filling young persons with aspirations and dreams, and you are contributing in a very, very big way. So kudos to you and best wishes also.
thank you so much, sir. Thank you.
Thank you. Thank you.
Thank you, sir.